These views of the chest show small hyperechoic echogenic structures. These are ribs, which are made of bone. Please also notice the heart and stomach. Let's move now to the abdomen. These are the important abdominal structures that we will cover: stomach, umbilical vein, umbilical cord, kidneys, bladder, and spine. This is a transverse section through the abdomen. Please ask your trainer to show this slice with a doll. This is the correct level in the abdomen to measure the abdominal circumference, and we will discuss why in a moment. First, let's point out the stomach in each image. The stomach is anechoic, black, because it contains fluid. The stomach normally varies in size. Now, let's identify the umbilical vein in each image. The umbilical vein carries oxygen from the placenta to the fetus. Because it contains blood, it is anechoic. Notice the curved shape of the umbilical vein at this level. Imaging the stomach and umbilical vein together is very important because it allows us to take a measurement here of the abdominal circumference to help determine gestational age. The dashed line in each image shows the measurement taken by the sonographer of the abdominal circumference. We will talk more about how to do this in the next lesson. When you look at the fetal abdomen, you will often notice the umbilical cord. The cord attaches to the fetal abdomen and the placenta. The image on the left shows the umbilical cord inserting into the abdomen. Please pause the video now to allow participants to identify the umbilical cord, fetal abdomen, and the cord insertion site. Here, we point out these structures to make them more obvious. The image on the right shows the umbilical cord in cross-section. The cord normally contains 2 arteries and a vein. You can see the vessels as round anechoic structures. We have labeled the umbilical cord here to make it more obvious. Kidneys can be seen in the second and third trimesters. The kidneys are oval-shaped on the sagittal view, and we have outlined a kidney to make it more visible. On the right image, the kidneys appear more rounded on a cross-sectional or transverse view. On this transverse image, you can see both fetal kidneys. Now, we remove the outlines to allow you to find the kidneys again. The bladder contains urine, so it is anechoic. It can normally be different sizes. The left image is a coronal view of the bladder. The right image is a transverse view. What do you think these hyperechoic structures are? Please pause the video at this time to allow the group to respond. The answer is that they are the femur bones in the thigh. We will talk more about bones in the leg in a few minutes. It is sometimes easy to confuse the bladder and the stomach. Both are anechoic. The bladder is low near the legs. The stomach is high near the ribs. We point out the heart in both of these images to further help orient you. Here are the transverse views of the bladder and the stomach. The bladder is low near the legs. Here we show the bladder and the femur bones in the thigh. The stomach is high near the umbilical vein. When the stomach and umbilical vein are imaged in cross-section, and the umbilical vein has this curved shape, this is the correct level to measure the abdominal circumference to determine gestational age. We will talk more about this in the next lesson. What do you think this hyperechoic structure is? Which plane is this? Please pause the video now to discuss as a group. The answer is that this is the spine and the plane is sagittal. The maternal head is to the left and the maternal feet are to the right. What position is the fetus in? Please pause the video now to discuss as a group. The answer is that the fetus is a breech. These are transverse views of the fetal spine. The spine is at the back of the fetus. In the left and right images, both spines are up. We have outlined them here to make them more obvious. The left image shows a young fetus whose spine is not well developed. The curved structures on either side of the spine are ribs. What is on either side of the spine in the right image? Please pause the video now to discuss in the group. The answer is that these structures are the kidneys. Now we'll finish with the extremities. The arms and legs are often well seen because bones are hyperechoic. Here we can clearly see the hand, forearm, and upper arm. Here is a nice image of the lower leg and foot. Notice that there are two bones in the lower leg. The larger bone is called the tibia, and the smaller bone is called the fibula. This makes it easy to distinguish the lower leg from the thigh, which has only one bone, the femur. Here's a view of the pelvis and the thighs containing just one bone in each extremity, which is called the femur. Notice that there is no second bone next to the femur. If you see a second bone, you are not looking at the femur. In the next lecture, you will learn how to measure the femur to determine gestational age. Let's review some key points. You should be familiar with the normal appearance of the fetal head, heart, abdomen, spine, and extremities. In order to accurately date a fetus, you must be able to identify structures in the brain, abdomen, and extremities. Questions for review. What are the 5 important parts of the fetus that should be seen in the second trimester? The answer is the head, heart, abdomen, spine, and extremities. Name at least 3 structures of the brain that you can see on ultrasound. The answer is the cavum septum pellucidum, or CSP, thalamus, the ventricles, and cerebellum. How many chambers should you see in the fetal heart? The answer is 4 chambers. Is the umbilical vein anechoic or hyperechoic on ultrasound, and why? The answer is anechoic because it contains fluid, which is blood. What color is the fetal spine on ultrasound? The answer is white because bone causes sound to reflect back to the transducer. How many bones will you see with the femur? The answer is just 1. Below the femur, in the lower leg, there are 2 bones. Thank you for your attention and interest in learning pregnancy ultrasound.